Hello everyone, I am Frank Adeano from Group 24. Good day. Today on this video I'll be taking you on steps of CPR. First we have to know what CPR means. CPR means cardiopulmonary resuscitation, and this is a technique used to sustain patients who have gone into respiratory or cardiac arrests, and this usually involves chest compression and rescue breathing. Before going further, would also have to clarify what is rescue breathing. Rescue breathing is where the rescuer blows air into the patient's mouth in order to perform the function of breathing for the patient until this patient, he or she, is able to breathe again on his or her own. Before starting the CPR, there are precautions to be followed, the standard precautions. This involves wearing a glove, if possible, and having a barrier device. Now, if this said patient who needs a CPR is bleeding, then you might need a gown, a mask, and eye protection. Now, there's two ways to perform CPR, one in an adult and the other way for a child. Now, in this case, firstly, I'll be showing you how to perform CPR in an adult. The first thing you have to do is inform the EMS, or you have a person inform the EMS, which is the emergency system. And then you make sure your patient's airways are open, which is by keeping the patient's face straight like this. When you see the patient's airways are open, you feel for breathing. You check for breathing. If the patient isn't breathing, then you perform ventilations, which is resuscitations, either by mechanical putting in oxygen into the patient's body, or air rather, or blowing mouth to mouth. Now, when you check for this, if the patient isn't breathing, you give two ventilations, one after each second. After this, you feel for a heartbeat. If there is heartbeat but still no respiration, when you feel for the heartbeat but there's still no respiration, then you have to give ventilations. You have to continue with ventilations, one every 6 to 8 seconds. Now, after checking for the heartbeat, if there is no pulse, then you have to begin chest compressions. And this is by 30, this has a 30-to-2 ratio, 30 compressions, 2 ventilations. Now, you have to make sure your hand is placed above the sternum correctly in this manner for effectiveness, and you push down 1.5 to 2 inches. When you do so, you have to make sure it is fast, it is rhythmic, and swift. When you do so, after 30 counts, normally there's two rescuers. One person is in charge of checking the pulse and is in charge of the ventilations, and one person is in charge of the compressions. So when you do this, you guys can also change every 2 minutes of resuscitating the patient, and make sure the time for changing should be around 5 seconds, not more. This is how you perform a CPR in an adult. Now, in the second case, to perform CPR in a child, you can still maintain the 30 compressions to 2 ventilation ratio. For if there are 2 rescue workers, then it can be shared 15 compressions to 2 ventilations. Now, given ventilations in a child, you have to make sure the rescuer has to cover both the mouth and the nose of the child. But be careful how much air you put into the child. It must be gentle so you do not overinflate the child's lungs. Now, in a child, you do not use your full hand or power because you can crush the child's chest. Rather, you use your fingers and you go 1/3 or half of the chest. Be careful not to overcrush the xiphoid process. This is how you perform CPR in a child.